You cannot use cholesterol to predict somebody's risk for heart. That is garbage. It is a lousy measure. In other words, if I told you your total cholesterol is 230, well, you're going to have a heart attack tomorrow, 10 years from now, 20 years from now? Never? You can't tell. There's no way you could use cholesterol to predict heart disease. The only real way to do that is to do something called a CT heart scan to generate a coronary calcium score. All you're doing is measuring the calcium in arteries, and you can do that very precisely because calcium, on average, occupies 20% of the total volume of atherosclerotic plaque in your coronary artery. So it's kind of a dipstick or a gauge, and it's very easy. It's low radiation. And once you look for hidden heart disease, you find it everywhere. And so what do? Now, these are people like you and me. These are people going to work, riding their bicycles, going swimming, going for walks, no symptoms. These aren't people in the emergency room having chest pain. These are just people going about their business. Well, back then, we would say, okay, take a baby aspirin, eat a low-fat diet. You've heard all this. Take a high dose of a statin cholesterol drug, exercise, right? Let's say your score is 500. Normal is 0, no calcium, no plaque. Let's say it's 500, and your risk for a heart attack is substantial. If you did nothing, not wise, but if you did nothing, it goes up 25% per year. So it'd be 625, something like that in a year. And then every time it goes up, you're closer to dying, having a heart attack, or needing a procedure because you're having chest pain. Well, if you put somebody on a baby aspirin, a low-fat diet, high dose of a statin cholesterol drug like Lipitor, exercise program, how fast does it go up? 25% per year. It has no effect whatsoever. It's garbage. Yet to this day, my colleagues still call it optimal medical therapy. I rejected the idea that cholesterol was helpful because I think cholesterol is a waste of time, but it makes a lot of money, right? So I did a more advanced test called lipoprotein testing. And you'll see right away, people who have coronary disease almost always have an excess, a high number of small LDL particles, not LDL cholesterol. It's an indirect marker, but the actual particles themselves are small, unusually small. And people would have something like 2,400 nanomoles per liter particle count per volume. And it would be a driver of increasing score. What foods, what processes cause that abnormal pattern of small LDL particles? The only foods that trigger it, wheat, grains, and sugars, not fat, not bacon, not olive oil, only wheat, grains, and sugars. And the reason for that, by the way, is the amylopectin A carbohydrate unique to wheat and grains is a flagrant trigger for this small LDL pattern. So I thought, okay, if statins don't work, aspirin doesn't work, low fat doesn't, let's just give this a try. We're going to take out the triggers for small. So we do that. Small LDL typically drops to 0, not 10% better, not 20%, 0. Eliminated. But people started telling me this. I did it. Yeah, my small LDL is now 0, and I lost 73 pounds. You didn't tell me I'd lose 73 pounds. I'm no longer a type 2 diabetic. I had to stop all my medications. My blood pressure dropped so low, I had to stop my 3 blood pressure medicines. My psoriasis is better. My rheumatoid arthritis is better. My migraine headaches are better. My depression is better. In other words, I did this for small LDL particles in people with coronary calcium scores. So I asked, well, why? Why would the food that every agency of the U.S. government, American Heart Association, the Academy of Nutrition and Dietetics, every agency, every dietitian, almost every physician said you must cut your fat, eat more healthy whole grains. I do the opposite, and I see magnificent transformations in health. And it also became clear that a lot of things being said in conventional healthcare, like cut your fat, cut your cholesterol, everything in moderation, push the plate away, more healthy, was nonsense. In fact, was the exact opposite of what actually works. You know, I had the advantage that people in my practice were all at risk for heart attack and death. So that's pretty scary stuff, right? And when they saw graphic evidence that small LDL particles, we used to have a graph of it. You'd see a big bar, and you'd see it shrink to nothing. But then you see other things happen too. Triglycerides would drop, blood pressure would drop, blood sugar would drop like crazy, hemoglobin A1C would drop, inflammatory measures like C-reactive protein would drop. And of course, all those other things happened. People lost huge amounts of weight. They'd say, I lost 6 inches off my waist. My joints don't hurt anymore. I don't have skin rashes. In other words, there was a whole panel, a long list of health benefits when people did this.
Don't hesitate to pass on the knowledge and hit the subscribe button on our channel for more practical health insights.